Bismillahirrahmanirrahim. Assalamu alaikum. In this lecture, we will discuss the technique for the open extraction of single-rooted teeth. We will create a few more videos to cover this topic comprehensively. After this, there will be a video with MCQs on the same topic. Please watch and understand this video first, then proceed to the next video for the MCQs. Furthermore, questions with answers on this topic for SEQ, VIVA, and OSCE will be available at the end of this presentation. Now let's start the technique for open extraction of a single-rooted tooth. This method is generally straightforward but demands meticulous attention to detail. It's particularly useful for teeth that have not responded to close extraction methods or have fractured and remain only as a roots. Understanding each step and rationale behind it is crucial for successful outcomes. The first and crucial step is reflecting a mucoperiosteal flap to ensure proper visualization and access to the tooth. An envelope flap that extends two teeth interiorly and one tooth posteriorly usually provides enough exposure. If additional access is needed, releasing incision can be made at least one tooth interior to the extraction site. Proper flap reflection is key to minimize trauma and facilitating the subsequent steps of the procedure. After the flap has been reflected and secured with periosteal elevator, the surgeon must decide whether bone removal is necessary. This decision depends on the specific conditions of the tooth and surrounding bone. Evaluating the situation carefully will guide us in choosing the most appropriate approach, whether it involves bone removal or other techniques. Several options are available depending on the situation. One option to consider is reseating the extraction forceps under direct visualization. By doing so, we can often achieve a better mechanical advantage, which might enable us to remove the tooth without the need for surgical bone removal. This approach can save time and reduce patient trauma, making it a valuable technique to master. In this figure, a small envelope flap can be reflected to expose the fractured root. Under direct visualization, the forceps can be seated more apically into the periodontal ligament space, which eliminates the need for bone removal. Another technique is to grasp a small portion of the buccal bone under the buccal beak of the forceps. This can significantly enhance our mechanical advantage and the grasp of the tooth root. By luxating the tooth in this manner, we may avoid further bone removal, simplifying the procedure. It is important to note that a small amount of buccal bone might come off with the tooth, which is generally acceptable. In this figure, if the root is fractured at the level of the bone, the buccal beaks of the forceps can be used to remove a small portion of the bone at the same time that the root is grasped. Using a straight elevator is another viable option. By pushing it towards the apex in the periodontal ligament space, we can begin to luxate the tooth. It is essential to support the elevator with the index finger to control the force and prevent slippage. In this figure, a small straight elevator can be used like a shoe horn to luxate the broken root. When the straight elevator is used in this position, the hand must be securely supported on the adjacent teeth to prevent slippage of the instrument from the tooth and subsequent injury to the adjacent soft tissues. A to and fro motion helps expand the periodontal ligament space, facilitating the entry of the elevator. Gradually using larger elevators will continue the luxation process until the tooth is adequately loosened for removal. If non-surgical techniques are unsuccessful, then we will go for the fourth option. We proceed with surgical bone removal using a burr. Remove the buccal bone with sufficient irrigation to keep the area clean and cool. The width of the removed bone should match the tooth's mesiodistal width, and the vertical bone removal should be about 1/2 to 2/3 the root length. After adequate bone removal, use a small straight elevator or forceps to extract the tooth. This method reduces the force needed for extraction and ensures a smooth removal process. In this figure, when removing the bone from the buccal surface of the tooth or tooth root to facilitate removal of that root, the mesiodistal width of the bone removal should be approximately the same as the mesiodistal dimension of the tooth root itself. This allows an unrestricted path for the removal of the root in buccal direction. After adequate bone removal, use a small straight elevator or forceps to extract the tooth. This method reduces the force needed for extraction and ensures a smoother removal process. In this figure, the bone is removed with a bone cutting burr. After reflection of the standard envelope flap, bone should be removed approximately 1/2 to 2/3 the length of the tooth root. Once the appropriate amount of buccal bone has been removed, the straight elevator can be used down the palatal aspect of the tooth to displace the tooth root in the buccal direction. It must be remembered that when the elevator is used in this direction, the surgeon's hand must be firmly supported on the adjacent teeth to prevent slippage of the instrument and injury to the adjacent soft tissue as described earlier. After the bone has been removed, and the tooth root luxated with a straight elevator, the forceps can be used to remove the root. We will complete the remaining part of this topic in our next video. However, in conclusion, so far the open extraction technique for a single rooted teeth demands careful attention to detail throughout the procedure. Adequate visualization and access are the most important. After reflecting the flap and securing it with a periosteal elevator, the surgeon must assess the need for bone removal. Several techniques can be employed to enhance mechanical advantage and facilitate tooth removal. Surgical bone removal using a burr with adequate irrigation. This approach significantly reduces the force required for the tooth displacement, allowing for the smoother extraction. Understanding and applying these principles ensures more effective surgical procedures and improve patient outcome. Finally, take a look at the questions designed to help you prepare for different examination formats. In this slide, you can see the question followed by two types of answer, one short and the other is detailed answer for situations where more information is needed, such as SEQs or OSCE formats or VIVA depending upon the exam pattern. Secondly, it is crucial to understand the question before answering. Avoid irrelevant material. For example, the answer provided for this question is sufficient. So review all these questions on your own and enjoy your studies. Good luck.